I'm Dr. Tom St. Giovanni, orthopedic surgeon, foot and ankle specialist. I've been in practice for 25 years, and today I'm going to be demonstrating a novel technique of using a OSSIOfiber 2.5 millimeter anchors for the treatment of lateral ankle instability. We're going to be showing a modified Brostrom procedure, which is probably one of the more classic procedures which we do for this condition. All right, so now that I got this exposed, here's my ATFL, right? Here's the talus here. Here's the distal tip of the fibula, lateral malleolus. And once again, the peroneal tendons are here. My superior peroneal retinaculum is coming in here. At this point, I'm going to make a bony trough for which I'm going to be able to put my anchors into. Sometimes too, I'll raise a little bit of the periosteum up, because this too can be something that you kind of fold over. This could be attached to your extensor retinaculum or just reflected over top of your repair site. So now I have that exposed. What I'll typically do for these, depending upon the real estate that I have here, is I may put 3 anchors. Okay, one here, and one that's slightly inferior to superior. Okay, or if there's not a lot of real estate, sometimes I'll put 2 anchors. And then you'll see that the technique I use is similar to a double row. It's essentially a double row. So I may put 3 anchors here. And I'll tie them first, crisscross the strands, and then bury them into the distal fibula. There's going to be an instrument kit that comes with this. Okay, and this is a 1.8 drill. Okay, and remember the anchors themselves are 2.5. Okay, so for the most part, this 1.8 drill should suffice. Now you'll occasionally have hard cortical bone in a younger patient. Then there is another drill that's a 2.0 millimeter drill, and that will come separately, so that can be opened up on the field. It's got to stop. Okay, I'm going to put another one here. So you can actually, if you want, you can use the drill guide, and this will actually slide through the drill guide. So we'll put this first one in. Okay. This just comes preloaded with 2 needles on it. So once again, you can insert this with the drill sleeve, right? Okay, if you have a clear shot and you remember the trajectory that you drilled, you could also do it without. It's getting down to that level. Okay, so now I have my Ossio 2.5 millimeter soft tissue anchors set, and they're anchored into the distal fibula. I have passed that through the anterior talar fibular ligament and the lateral capsule, and we have tied down the knots so that we have brought, let's say, that ligament back down to the bone. Now I've used 2 anchors here, but if you do have room and you would like, you could actually add a 3rd anchor, which would be slightly posterior. And if I do, and I do this often sometimes, that I'll put another anchor kind of from a superior to inferior direction and catch some of the CFL, right? So I have to kind of bring the peroneals out of the way and catch some of that to tuck it in. But for the most part, you're catching your ATFL. And what I'll do is then I'll bring one tape north, one south, and same thing here, okay? I've already pre-drilled 2 holes with the same 1.8 millimeter drill, and I'm going to bring 2 this way, and then 2 this way, okay? And we're going to sink these in, and these are going to be, and then you can cut these flush with the distal fibula. Okay, so this is also a 2.5 millimeter OSSIOfiber soft tissue anchor. It does come in a snare configuration as well. so that you can be able to pass suture through the eyelet. We're going to take one at a time. I'm going to pass it through this little nitinol loop. Okay. I'm going to bring it through. Okay. I'm then going to take this and I'm going to pull this distally. Okay, so that I have clearance. Let's say to pass this again. Make sure that you pass them in the same direction. Okay, don't get distracted. Otherwise you have to kind of do it again. So here we're going to pass the second one. Okay. I'm going to pull down a little bit like this. And so you want this to slide nicely. Okay. So what I'm going to do now is I'm going to pull a little bit of tension on it. This should anchor it down. Okay. And that pulls out. Okay. We're going to take our second limb and we're going to bring it this way. Now this, once again, this gives us a very nice broad footprint to be able to draw that ligament back down to that bony trough. So again, you may have to put like a little tension on it to kind of keep it down so it doesn't want to pop out the top, okay? And you slide it down. Once again, you get your tension on it, okay? Take out some of that slack, okay? Find that hole there. You could at this point, if you want, okay? Put a little more tension on this as you're pushing down here, right? Maybe even use this is here. Same thing here. Put a little tension on it. Okay. You hold it, and in the same direction that you drilled. Okay. So now you have that double row, right? It's a very secure repair. Okay. I will usually space these out a little bit more if I'm doing two, right? I'll put one here and I'll put one further here, okay? Or like I said, you could use three and be able to get those down. Depends on the amount of, once again, the amount of real estate that you have. Then you can cut these flush with the distal fibula. So it really leaves, it's a nice solid repair, broad footprint, and you're not having, let's say, the tails of the tape or the suture right against, let's say, just underneath the skin.